Right now, we will discuss about aneurysm. What does it mean? Aneurysm means abnormal dilatation of blood vessels. It can be of many types. Can be true, false. The most common cause of aneurysm is atherosclerosis. When we can divide the type of aneurysm uh, like atherosclerotic and non-atherosclerotic causes. The atherosclerotic causes are very common. Among non-atherosclerotic causes, the first one is congenital, then lytic. Lytic is due to syphilis infection. Trauma also can one of the major cause of non-atherosclerotic aneurysm. Uh, then mycotic causes. Mycotic, this word is misleading term. Mycotic, it's appear that it is due to fungus, but in reality it's due to the bacteria. And the last non-atherosclerotic causes is secondary to vasculitis. We know that vasculitis is autoimmune problem, and in this lot of inflammatory cells participated, and due to severe inflammation in the blood vessels, the blood vessels get the normal architecture get disturbed, and their elastic normal parallel arrangement will be disrupted, and ultimately due to weakening the aneurysm can take place. The other different types of the aneurysm we can divide into on the basis of shape, like saccular, fusiform, then on the basis of hemorrhage takes place or not. If hemorrhage occurs, that is hemorrhage or hematoma. Hematoma would be the better term. Dissection. In dissection, there is hematoma formation in the wall of artery, or even outside there is hematoma formation or hemorrhage can take place. Then one by one we will see description of all the things we have discussed right now. In this diagram, in the center we will see the normal vessels, and side by side there is true aneurysm and false aneurysm. We are seeing that in true aneurysm all the layers of blood vessels participated, while in false aneurysm some part of the blood vessels wall participated and other are remain all right at their places, and there is hematoma formation. So this is the main difference between this. Here in this diagram, atherosclerosis is the major cause, and microscopically we are seeing two slides. The one is having normal elastic fibers, normal arrangement of the elastic fibers, mean before atherosclerosis has happened to the artery, and the next one where the elastic fiber are fragmented and disrupted, it's occurred due to atherosclerosis. When the atherosclerosis, once that takes place, then the wall get weakened and abnormal dilatation or aneurysm of the blood vessels occurs. In this diagram, this is the cross specimen of abdominal aortic aneurysm, and the most common area where abdominal aortic aneurysm takes place is between renal artery and bifurcation of aorta. Then thoracic aneurysm, where the major blood vessels of the thorax participated, and aneurysm takes place. As the aneurysm occurs in the major blood vessels, the encroachment or pressure effect on the surrounding organs will occur, and due to that compression or due to that encroachment, the patient will face respiratory difficulties. If compression of nerves takes place, then hoarseness will occur, dysphagia due to esophageal compression, cough, pain, aortic valve. All features can be clinical features can be seen in the patient according to their involvement of the organ, and ultimately the rupture can be the consequence of the complication. Then lytic aneurysm, we have already discussed something about that. It is due to syphilis, and in syphilis the main arteries involved is thoracic aorta, and on microscopic finding, if we examine the blood vessels, we will see the predominance of plasma cells, and by that we will make the diagnosis. This is the dissection of the blood vessels. In this diagram, we will see the wall of large artery, and the media adventitia and intima is also visible. There is one star mark at one a structure, that is hematoma, and that hematoma formation took place because a rupture in the wall of the blood vessels, and that rupture will occurs in the wall only. That rupture cannot happen in outside. Can occur, but in this diagram we are seeing that hematoma formation in the wall itself. And because the artery looks very thick, it can be the major artery, because such great amount of elastin fibers are available in the aorta like structure only. And the last, we will discuss about the complication of aneurysm. The most dreaded complication is rupture of the great arteries. That rupture itself can cause hematoma formation. That hematoma can cause obstruction. Then if stasis of blood vessels at that point can lead to embolism. That hematoma can cause compression of ureter, compression of spine, and sometime because of aneurysm, that mass effect can be seen, which mimic malignancy. So we can rule out these things by other investigation, radiological or pathological investigation available with us. Thank you. Then revise the chapter and